You do know that Ghana has announced its first case of COVID-19. We did that by 12 of March. We reported 2 imported cases. Since then, there have been hikes in cases from abroad until community spread also began. It set in with community spread. It's now surpassing the 70% mark against imported cases. But with the country's case count nearly 2,800, how many more cases are we to expect in the coming days and weeks before we start seeing a decline? Because that's how it typically works, you know, the curve that they talk about. Well, the Director of Public Health at the Ghana Health Service, Dr. Bedusa Kodia, dropped a hint on that yesterday during the Ministry of Information COVID briefing in Accra. Listen.
When there are a number of factors at play which make the disease spread, then you are talking of a graph that is mimicking a polynomial curve. And at those circumstances, you are nowhere near your peak, because you need to decrease the number of factors that are impacting on the spread. And how do you know that you are decreasing the number of factors? You know from the reproductive number, which the R number, which everyone talks about, which is the number of people that get infected if one person gets infected quickly.
We started having a build. The first confirmed case in the country was on the 12th of March. Since then, those were from the people that we put together later, those that were put on quarantine. Out of the 1,030, within a short time, we had 115 of them. Those in quarantine at Accra here and also in Tamale. So we realize that with a sharp rise, and now with the cases that we are tested, clearly we seem as a country to be on top of the peak, and we are at a stage to decline. That is the observation now. The declination will depend on how we adhere to the various preventive etiquettes that have been enumerated. We are not off the hook yet. But then if we continue the way we are doing now, by adhering to the various social distancing, adhering to the various individual preventive measures, wearing of mask, keeping away a distance from others, hand washing, cough etiquettes, other respiratory etiquettes. These are the things, when we do intensively, will let us come down from where we are. So responding directly to the question, where you are at the peak of the curve, yet to come down. But then the only thing to make us come down by strict adherence to the various preventive etiquettes.
We are at the peak of the outbreak, he says. But what does it mean to be at the peak? Well, that has actually set the debate going as to whether the country has hit that peak, or is it just in the middle of a rather rising curve. 3 experts are related but different backgrounds have all challenged this position. Biologists at the Kumasi Center for Collaborative Research, one of the key research and testing centers, disagrees with this. Listen to Dr. Isaac Owusu speak to NS Menu on News Desk here on this channel.
When there are a number of factors at play which make the disease spread, then you are talking of a graph that is mimicking a polynomial curve. And at those circumstances, you are nowhere near your peak, because you need to decrease the number of factors that are impacting on the spread. And how do you know that you are decreasing the number of factors? You know from the reproductive number, which the R number, which everyone talks about, which is the number of people that get infected if one person gets infected quickly. As of now, myself and other colleagues, our estimate of Ghana's R number is it's greater than 2.5.
So greater than the world average, or the world R naught?
No, the world R naught now is being quoted around 3. I mean, there are even some studies that are coming out which are quoting it around 3.4.
Right.
The problem with an R naught calculation is that it tends to change depending on the interventions you make. And that is why I started from talking about the factors that you can change the factor. But the reality of the matter is it's also true to say that you are getting more positive results because the disease is spreading. Because if the disease wasn't there, before it got into Ghana on 2nd March, even if you did 100,000 tests, you wouldn't get a single positive case, because the disease is not there. The fact that you are testing more means you'd identify more, but also means that the disease is spreading more. And that is why, in my opinion, we are nowhere near our peak.
Nowhere near our peak, he says. The Director General of the Ghana Health Service, Dr. Patrick Abuaje, has, however, been defending the service's position. He also spoke on News Desk.
From the data, in simple terms, what we are looking for communicating to the public is the fact that the rate of increase has stabilized. The number of admissions, people who are going to hospital, has actually slowed down. It's stable and actually a bit on a downward trend in terms of the case of those who need to require admission. And then finally, if you look at the number of deaths, that has also remained quite stable and actually slow. So on the face of that, one can look at that. But in terms of, for example, whether we go up or continue to go down or stabilize, it depends on what we all do.
So are you saying that we are not there yet in terms of...
That's not what I said.
Okay.
I said we speak for all of us, and that is our position.
Okay.
Whether we continue to say go up or down depends on what we all do.
Very well.
We ramp up the public health protocols and measures. Compliance is important, and we continue our testing and tracing and isolation. Then we will still be able to.
So this afternoon, we want to subject these claims to some analysis. We want to scrutinize the position. Where are we? How do we even calculate this peak when it comes to pandemics? Before we do that, let's hear from Dr. Michael Owusu.
We have to be quite cautious about saying we have arrived at our peak. And a lot of variables will have to come into play before we can say that we are at our peak. And the peak that the curve varies even regionally. And I mean, Accra could be assuming a certain curve. Kumasi may not have. The central region may also start their own. So first of all, I mean, to put all the data together nationally, and then to say we have arrived is something that has to be done cautiously, which I feel that a lot has to do with this, and the evidence on the ground doesn't seem to maybe suggest to. The reason why I'm saying that is that before you can plot the epidemic curve, you need real-time data. This data talks about the incident cases per unit time. So every day, how many new cases you get. And ideally, you must have this on a good Excel sheet. That tells you that from the 12th of March to date, every day, how many cases you get. And the cases not based on cases that are reported by the lab, but cases based on the samples that are collected from the people in real time. So even if you have 500 cases coming out on the website, you will have to go back and then align this to the date on which the samples were. So first of all, give you a clean data of the number of new cases you have. And then based on that data, you can now plot your epidemic curve and then understand how you are.
So that's Dr. Michael Owusu. He's a virologist at the KCCR. Really, how do we get that sorted out? Like I said, we want to have a bit more of a conversation, try and analyze the position of our health experts and the contradictions, if you like, that we're getting. Dr. Grace Ayensu Dankwa is a public health expert. She joins us via Zoom. Before I start, Dr. Ayensu, thank you very much. Thank you very much for joining us this afternoon. But let me indicate that before we even have this conversation, my producers have reached out to Government COVID-19 Coordinator, Dr. Anefi Asamoah, to help us bring some clarity to this issue. He has declined to speak to us on this show. He says he does not speak to the media, so we can get on with this conversation without his views for now. Dr. Ayensu, thank you very much for your time this afternoon.
Thank you so much. How are you?
I'm not doing bad at all. So, first of all, let's look at the curve. I want us to understand what this curve means. We've spoken about it every now and then, so we're all beginning to accept that there is a curve. But what does this curve mean? What is it when we're talking about a pandemic?
The curve is only what we do as a statistical measure So what it means is when we say a bell curve, we mean what we're talking is like a bell. You know how the bell starts, the part that we ring. It starts from the bottom, it goes up to the top, and it comes back down where the little knob is that rings the bell. So it's called a bell curve. So what the bell curve is that we start from 0, which is the bottom of the curve, and then we go all the way up, get to the peak, and come down to the bottom of the bell.
And that's expected to be the lifeline of a pandemic. So you start at the bottom, you go all the way up. That's it. You have a lot of infections, deaths, and then it goes all the way back down. That's the expected lifespan.
Exactly. That is exactly what you're right.
Right. So when people say the peak, we want to quickly find out where we have reached on that curve so we know that we're going to go down eventually from now.
So the peak is where you hold the wooden thing and ring the bell.
Yes.
So that is the peak of the curve. That's the top of the curve.
Right.
What you want to do when you get to the peak is you either want to flatten it so it doesn't go so steep, and then it's flat and then it comes down, or it goes too steep and then it's like a cone when it comes down.
Okay.
Right now, what they're talking about that we have reached the peak of the curve, that doesn't make sense statistically.
Okay, I'll come to that, Doc. I just want us to set the background so that my viewers can follow and they have a full appreciation of the conversation we're having. So you've given us the idea of the curve. Now, the thing is, our government health authorities are saying that we are at the peak. What does it mean to be at the peak? I mean, how is the peak calculated? For example, is it by the number of the population? Is it by the health system? How do we calculate generally a peak in a pandemic?
The way you calculate the peak is how many new cases you have in the next 24 hours.
Okay.
And you know that since we lifted the ban, we've been going up exponentially, like I think the numbers have even added up more. In the last 24 hours, the last time the Ghana Health Service updated was May 2nd. We have gone up almost 550 cases. So that means that we are still going up at the exponential part of the curve. Is the numbers. The only time you know that you've reached your peak is that, for instance, you get to a certain number, then the next day or the next 24 hours, the number comes down or it stays the same and then it starts going down.
Okay.
So when they say we have reached the peak, they don't even know the peak, as we have continually gone up every single day or every time they've updated the numbers. We are more on the exponential phase. We are nowhere near the peak.
Okay, and the exponential phase, they've explained that some of the figures we're seeing now are not cases that are just being now tested. They are cases that are coming from a backlog that we've had to deal with. And so these are cases that we've recorded already. Does that add anything to the discussion, to the explanation?
But the backlog argument doesn't make any scientific or logical sense. In other words, all the backlog is that, for instance, the test is on the way to the testing center, or the test has gotten already to the testing center, but they haven't tested it. So that is where you talk about the backlog. That means that there's this test that has come that you haven't done. But if you have a backlog, that only implies that you're not nowhere near your peak and you are even more exponentially rising, because you have to test all those people that are backlogged to know how far you are. Yeah. Only the numbers, the scientific numbers, the number of people that have the disease that are testing positive per day will determine whether you are in your exponential phase or you are in your peak. So for instance, let's say that yesterday or today we are 2,700 or something.
Yes, 2,719, yes.
Yes. So the 2,719, the next 24 hours, the numbers that come, if equal to 2,719 or coming down, it's only when we know that we are reaching our peak. You don't get your peak when you keep rising.
So is it possible that the next time that there will be an update that will actually be recording lower figures, and that's when we'll be able to have this conversation better?
Thank you. Exactly. You're so right. When we get that number is when we can have this conversation, because the peak is not someone else's, what someone else thinks. It's a scientific number, it's a scientific process, it's a medical process. It's not someone's imagination or what someone thinks. So let's wait for the next numbers.
What do you make of the possibility that being the people who are actually handling this, they perhaps have the figures, they have seen the figures, so they know what they're talking about when they say we are at our peak at this point?
But it's not a private number, it's a public information. So you bring the numbers moving forward, and then we, the scientists or the scientific people, determine whether we've peaked or we haven't peaked. As we speak right now in the Western region, we started from 2. Then we went to 11, then we went to 13. As of today or yesterday, we are 23 or 24.
Yeah, 23.
We are nowhere near our peak. We are still rising on the exponential phase of the curve.
Okay. As far as public health is concerned, would you at this point put out the figures you are demanding at the moment to be able to determine whether we are at the peak? As far as public health ethics or the way that public health operates is concerned, would you, if you were any of the people who are handling our situation at the moment, put out the figure right now to help us determine whether we are at the peak? Will it even be necessary?
We don't have to provide any number. All we are doing as public health officials is wait for the government to give us the numbers. If you give us consistently or consecutive numbers of 3 or 4, and after the 3 or 4 consecutive numbers, we are either plateauing or we are coming down, it's when you decide that you've reached your peak and you're coming down. It's not an arbitrary number. It's not a number that someone else has to give. Simply the amount of people you've tested, how many more have tested positive, how many of the contacts are still pending, and how many of the contacts have tested positive. It is not an arbitrary number. Nobody has to make it up. It's simply public information, and it's what we are recording.
And these are the things that will help us determine an actual position of Ghana as far as the curve is concerned.
Exactly. That is the only numbers. The government has to give us the numbers. Then the scientists will determine whether we are at the peak or we are trending downwards or we're still going up in the trajectory. It's a bell. So is the bell going up? Is it on the top of the bell or the bell coming down? And it's strictly based on the numbers.
And if I get you right, consistent updates by the health authorities on the numbers, the cases we are recording, etc., will help everybody make a better judgment of whether or not we are at the peak.
That is the only way, because it's a scientific number. That is the only way we know whether we're at peak or we're coming down. So far, it's someone's opinion that we're on a peak. But a peak is not an opinion, a piece. It's not somebody's opinion why he thinks we're at peak. It is the numbers that come out. How many people have we tested?
Yeah. And
how many contacts do they have? Have we tested all the contacts? So far as we see it, in every single region, or the regions that have tested some cases, we still keep going up. So we are still on the upward trajectory. And in fact, since we lifted the ban, our trajectory is even higher and steeper than we expected. As of the May 2nd, the last update on the Ghana Health Service website, we have gone up 550. Before the lockdown and after the lift of the lockdown, this is one of the highest numbers we have added in the last 24 hours. So let's look at the science, concentrate on the science. Let's not add politics. It's a global pandemic. It knows no political color or political affiliation. It is simply medicine or public health, and it's simply a statistical number. So let's wait and see how we go, what's the next consecutive 3 or 4 numbers, and let us determine medically or scientifically or logically or public healthly how far we are, whether we are at peak or we are not at the peak.
All right.
It's not somebody's opinion.
Dr. Ayensu, I'll say a very big thanks to you for joining this conversation. Like I indicated, we reached out to government representative on COVID-19 to also get government's perspective, you know, as far as the discussion is concerned. So government officials have made the statement, but we wanted to have a discussion so we give you a better understanding. We've reached out to government's representative. He did not agree to talk to us. He declined to talk to us at this point. And so you've been listening to Dr. Ayensu Dankwa. She's a public health expert, also a member of the NDC COVID-19 team. Thank you very much, Doc, once again.